And thank you, colleagues. I am very excited for all of us to learn about the one-year progress of Portland Street Response. It has been a fabulous opportunity to really dig in and see whether or not a non-law enforcement response to people suffering on our streets would be an effective tool. I believe I'm going to turn this over to Robin Burke, who is the program manager of Portland Street Response, and she will introduce our program for today. Am I right, Robin?
Sure. Hi, everybody.
We can't hear you, Robin.
You can't hear me?
That's weird. I can hear. Can you hear me?
I can hear you.
Oh,
I
good.
can hear the
Well,
You
mayor
can
and I
hear
can hear
her?
Robin.
you're gonna have a great presentation.
Oh, then maybe it's my computer. All right, my bad.
All right, Greg, save us.
Yes. Well, thank you, everybody, for coming here and joining us. It's been a pleasure and an honor to lead Portland Street Response for the past year. I'm really pleased with the outcomes of the last year, and I'm going to go ahead and hand it over to Dr. Greg Townley, who will be sharing with you his findings from the past year. Thank you.
Thanks, Robin. Thanks, Commissioner Hardesty, and great to be with you today, City Council. I'm going to share my screen and do the obligatory, can you see it? And then we'll get going. Let's see.
Looks good.
Great, thank you. So again, thank you, City Council, for inviting me to present the findings of the one-year evaluation of Portland Street Response. My name is Dr. Greg Townley. I'm an associate professor of community psychology at Portland State University, and also co-founder of the Homelessness Research and Action Collaborative at PSU. I'm excited to present what we've learned in the first year of Portland Street Response, and then to have a discussion about ways we can ensure that PSR remains as successful and community-centered as possible as it scales up citywide. And the presentation will last around 45 minutes, but I welcome you at any point to bounce in and ask any questions that you may have. This work would not have been possible without the contributions of so many people. First, thank you to my doctoral student and report co-author, Emily Likely at Portland State University. Thank you to the following City of Portland employees who worked closely with us and provided invaluable feedback and assistance to inform the evaluation. Tremaine Clayton, Britt Urban, Heike Mushi, Heather Middleton, Brian Chavez, Kelly Shaw, Zeke Martin Brunghart, Matt Coffey, Robin Burrick, Karen Brooks, and Andy Stevens with Portland Street Response. Melanie Payne, Chelsea Labar, and Kittis Yard with the Bureau of Emergency Communications, BOEC. Kristen Johnson, Carly Edwards, and Matt McNally with the Office of Commissioner Hardesty. Thank you to Street Roots ambassadors, Raven Drake, Gary Barker, Matt Perkins, Anthony Rogers, Chris Pierce, Lee Vaughn, Doug Marks, River Reese, Johnny Rotten, Gary Sorrenti, Marcus Ruby, Chris Drake, and Tamara Napper for leading the surveys of unhoused community members. And to Holly Brott, Desiree Du Bois, and Kenna Dickard from PSU for assistance with data collection. Thank you to Mike Gordy with Image Trend, Lauren Brown with Portland Police Bureau, and Justin Hauk with Portland Fire and Rescue for assistance with data reports and interpretation. Thank you to Mackenzie Carroll, Stephanie Knowlton, and Jason Green with the Homelessness Research and Action Collaborative for graphic design, report layout, and communications. Finally, we are so grateful to everyone who spoke with us about their experiences with Portland Street Response. This report would not have been possible without your willingness to share your voice. And this work was funded by the City of Portland Bureau of Fire and Rescue. To give a little bit of an overview, Portland Street Response is a new branch of the first response system in Portland, Oregon, that assists people experiencing mental health and behavioral health crises. Operating within Portland Fire and Rescue, PSR launched on February 16th, 2021 in the Lentz neighborhood and expanded to cover the entirety of the Portland Police Bureau East Precinct on November 4th, 2021. The founding team consisted of a firefighter paramedic, a licensed mental health crisis responder, and 2 community health workers, one of whom also serves as community engagement and outreach manager. With a second team added in November, consisting of a firefighter EMT, a mental health crisis responder, and 2 peer support specialists. From February 16th, 2021 to October 28th, 2021, the PSR hours of operation were Monday to Friday from 10 a.m. to 5 p.m. From November 4th, 2021 to February 16th, 2022, the first team responded to calls Monday to Thursday from 9 a.m. to 5 p.m. And the second team responded to calls Thursday to Sunday from 6 p.m. to 2:30 a.m. Here you'll see in these photographs each team on the first day of their service, with team 1 on the left, team 2 on the right. And then here these figures display the pilot boundaries, with the map on the left including the original Lentz and greater Lentz boundaries, and the map on the right showing the expansion to the entirety of the PPB East Precinct in November 2021. Portland Street Response is dispatched from the Bureau of Emergency Communications when a caller reports one or more of the following and the individual has no known access to weapons and is not displaying physically combative or threatening behavior. It's a person who is possibly experiencing a mental health crisis, intoxicated and/or drug affected. This person is either outside or inside of a publicly accessible space, such as business, store, or public lobby. It's a person who is outside and down, not checked. A person who is outside and yelling. And a person who needs a referral for services but does not have access to a phone. And then to provide a reminder and an overview of the purpose of the program evaluation was really to determine the overall effectiveness of the Portland Street Response pilot program, to provide suggestions for program refinement and adaptation throughout the pilot year, and to provide recommendations for scaling Portland Street Response up citywide by the end of the pilot. My research team and I used a mixed methods approach to evaluation, including both qualitative and quantitative data collection and analysis. You'll see numbers representing PSR call information. You also see words, quotes, representing people's experiences with the program. Both types of data are critical in informing our understanding of how Portland Street Response is working and ways to continue to improve it. The evaluation was comprehensive, community-centered, and included feedback from a variety of stakeholders and sources. We reviewed key performance measures and operational metrics pertaining to monthly call volume, average response time, number of referrals made. We obtained feedback from a variety of stakeholders, unhoused community members, Portland Street Response clients and staff, other first responders, and general community members. And we aggregated and triangulated across multiple sources of data. PSR charting system information, review of field notes with no identifying information, Portland Street Response dashboard, BOEC dashboard about Portland Street Response, surveys and focus groups and interviews. We attended weekly meetings. I did 2 ride-alongs with Portland Street Response, 1 sit-along at BOEC, and consulted with other similar programs across the country. It's important to note throughout that our numbers may differ from those you'll see on the Portland Street Response data dashboard due to differences in time intervals. Our evaluation corresponded again to that period of February 16th, 2021 to February 16th, 2022, while the Portland Street Response dashboard is updated weekly. And we also consulted multiple sources and triangulated across different dashboards and sources to arrive at our final numbers. Also important to note that this evaluation documents the first year of Portland Street Response's service, a year in which the program was learning what worked and what did not work, establishing trust and recognition from community members, and navigating the second year of a global pandemic. The dynamic, ever-evolving nature of the program means there is still much to learn, especially as now Portland Street Response has scaled up citywide and is operating in all parts of the city. So with that, I'll get into the findings. In the first year of the Portland Street Response program, Portland Street Response responded to 903 incidents. This graph shows a timeline of monthly call volume and significant programmatic changes during the 1-year pilot. You can see when the second team was added, they're in the darker green compared to the lighter green. In total, 90% of calls were dispatched by the Bureau of Emergency Communications, with 52% coming from calls into 911, and 38% of these coming from calls to the non-emergency number. And then 10% of PSR calls were from self-dispatch. They observed something in the field and dispatched themselves, or they learned about a call from another responder and dispatched themselves. Of the 903 calls, 824, so 91.3%, were calls traditionally responded to by the Portland Police Bureau, and 79, 8.7%, were fire and medical calls traditionally responded to by Portland Fire and Rescue. The 824 calls traditionally responded to by PPB are ones that are now coded as Portland Street Response, or PSR calls, based on meeting the call criteria that I outlined earlier in the presentation. This is a really important distinction, both to reinforce and institutionalize the idea that these are no longer calls that require a police presence, and also to designate Portland Street Response as a new and distinct branch of the city's first responder system. However, in this still early stage of the program, it's also helpful to understand the primary types of calls that Portland Street Response is diverting away from police. That is, what would have they been coded as police calls prior to being coded as Portland Street Response calls? To understand this information, we reviewed initial call text that came into BOEC and that were dispatched as PSR calls, and coded them according to the primary police call types that PSR was intended to reduce. Welfare checks, which made up the vast majority of the calls that the team responded to, around 85% of the 824 police calls and about 75% of all calls. And then unwanted persons calls, which were around 14% of the police calls. And now, while the vast majority of calls that Portland Street Response responded to and will continue to respond to are ones that Portland Police Bureau would have previously been dispatched to, the fact that PSR is located within Portland Fire and Rescue means they can also take some calls away from fire. The 79 calls in this category represent both fire and medical calls, with the two most common types being behavioral health issues and calls involving illegal burns, which typically involve cooking or warming fires at people's camps. Other calls range from health-related concerns that arose during the course of Portland Street Response's work, like heat or cold exposure and breathing problems, or police requests for medical assistance that were dispatched to Portland Street Response instead of fire. The average response time for Portland Street Response in the first year was 13 minutes and 48 seconds. The 90th percentile time was 24 minutes and 13 seconds, meaning that they were able to get to 90% of the calls in under 24 minutes and 13 seconds. And this is well above the state standard for mobile crisis response time of 1 hour, well below that. The average on scene time was 15 minutes and 46 seconds for all calls, and 20 minutes and 51 seconds for calls involving clients. The vast majority of PSR calls, 89%, required no co-response. Portland Street Response requested assistance from another first responder 68 times, while other first responders requested co-response with PSR 31 times. You can see here that co-response was typically either with police or AMR, American Medical Response, so ambulance. And it's important to note that in addition to these co-responses, so these would be when units are responding together on a call, there were also numerous instances in which other responders transferred calls or requested that Portland Street Response take a call instead of them. For example, the Portland Police Bureau requested or transferred around 50 calls to Portland Street Response, and Portland Fire and Rescue around 10 calls. The most common outcome of calls in which the Portland Street Response team made contact with clients in the field was that the client was evaluated and no further treatment was required, which occurred in just over a quarter of all calls. 1/3 of calls that Portland Street Response was dispatched to were canceled when a client could not be located and thus resulted in no client contact. This reflects the difficult nature of the calls that Portland Street Response responds to. In many cases, others have called to request service for the person they believe is in crisis, and this person may not wish to interact with first responders or may have moved away from the initial location. This finding is quite similar to figures reported by the Denver STAR program, a similar response program in Denver, Colorado. They noted that around 1/4 of calls in their first year of service resulted in no client contact. It's also similar to Portland Police Bureau calls in the PSR service area during the pilot for welfare checks and unwanted persons calls, where police weren't able to locate clients in around 1/4 of these calls. For information about other client outcomes, they're noted in this table. Also very important to note that no PSR calls in the pilot year resulted in client arrests, and thus no individuals were introduced to the criminal justice system as a result of their contact with Portland Street Response. In the field, staff noted that 65.1% of clients that they contacted involved someone experiencing homelessness. 51.9% of client contacts involved someone with suspected mental health needs. 47% had suspected needs related to drug or alcohol use. 36.1% had suspected co-occurring needs, so both mental health and drug or alcohol use. 55.9% had unmet basic needs. They may have been malnourished, dehydrated. They might not have had proper clothing for the weather. 2.8% had acute health needs, such as open wounds, bleeding, or heat stroke. 2.8% had visible chronic health needs, such as diabetes and arthritis. Very important to note that these numbers are likely underreported because the team does not always have enough information about clients to document these needs with certainty, especially around the acute and chronic needs. They tend to be conservative about assigning labels such as homelessness or mental illness to avoid further assumptions or stigmatization regarding homelessness and mental health and substance use distress. So again, these numbers may be lower than the actual experiences of clients in the field. The average age of clients was 38, ranging from 11 to 81. And just over half of clients were men and 46% were women. One client identified as non-binary. Most clients were white, around a quarter were Black, Indigenous, or other people of color. And data regarding gender and race should be interpreted with extreme caution, given that staff are not able to collect this information from all people. And further, because people are often in crisis and unable to respond for themselves, it's often an assumption based on clients' appearance and may not reflect their actual gender or racial identity. It's still important to collect all the information we can while understanding the limitations of basing it on observation rather than self-report. Portland Street Response initiated 65 transports to hospitals, walk-in clinics, and clients' homes. While PSR was able to treat the vast majority of clients in the field, 29 clients had to be transferred to AMR for transport to the hospital. Of these 29 hospitalizations, 17 were for mental or behavioral health reasons, 12 were for medical reasons. In addition to hospital transport, PSR initiated 17 taxi transport, 10 transports they did directly to clients' homes or homes and friends or family, or perhaps agencies like the Cascadia Urgent Drop-In Clinic. And they also helped to coordinate 9 family member transports where a family member would come and help that individual home. These operational metrics and performance indicators help us address 3 primary outcome goals that were determined in consult with stakeholders prior to the beginning of the pilot. The clearest, most pressing goal guiding the implementation of Portland Street Response was to reduce police interactions with people who have not committed a crime. And in order to understand the reduction in police response that occurred because of Portland Street Response, we can compare PSR's call volume with PPB's call volume in the same service area and during the same operating hours. And in our analysis, we found that the PSR call load represented a 4% reduction in total calls that police would have traditionally responded to in the PSR service area during the PSR pilot period and service hours. This 4% reduction is in line with other alternative first responder programs around the country. For example, the Denver STAR program noted a 2.8% reduction in their first 6 months of service. Cahoots in Eugene, which is kind of considered the gold standard, notes a 17% reduction, although the Eugene Police Department says that that number may be closer to 5 to 8% when you factor in co-response or self-dispatch or calls that come into a crisis line rather than 911. Applying this figure out citywide, this 4% figure, we estimate that PSR could have responded to at least 15,000 calls if the program had been operating citywide and 24/7 during the first 6 months of the pilot. Also important to note that with expanded call criteria that I'll discuss later, this figure could be quite higher. Outcome 2, reduce the number of behavioral health and non-emergency calls traditionally responded to by police and fire. Now, the previous analysis was all Portland Police Bureau calls. Here, we're really focusing in on the primary call types that Portland Street Response is intended to divert away from police. And those would be non-emergency welfare checks and also calls that are coded as unwanted persons calls. During the pilot's operating hours and in the PSR service area, we found that PSR activity represented a 27% reduction in PPB response on non-emergency welfare checks and unwanted persons calls, okay? So over a quarter of those calls that are the ones that are really within Portland Street Response's wheelhouse. We're looking at over a quarter of those calls being able to be reduced from the Portland Police Bureau call load. And then for fire, we can look at behavioral health calls and illegal burn calls. And here, during the pilot's operating hours and in the PSR service area, we found that PSR activity represented a reduction of 12.4% in Portland Fire and Rescue response on behavioral health calls and illegal burn calls. Then finally, outcome 3, reduce the number of medically non-life-threatening 911 calls that are transported to the emergency department. As reported previously, 29 calls, 3.2% of all PSR calls, resulted in clients needing to be transported to hospitals for additional treatment. The vast majority of PSR calls were resolved in the field with no need to transport people to the hospital for additional service. The team provided wound care, checked vital signs, administered medication. For example, Narcan was administered in several incidents. And they helped to de-escalate mental health crisis so the client received the care they needed but did not have to engage in intensive emergency services. As Portland Street Response is expanding citywide, the impact of the program on emergency department utilization will become clear, but this initial rate of 3.2% of PSR calls is substantially lower than the rate of Portland Fire and Rescue calls that resulted in transport to the hospital during the pilot year, which was around 17% of all PF&R calls and 13.4% of PF&R calls involving unhoused people. For another point of comparison, we looked at similar alternative first responder programs across the United States and noted the PSR hospital transport rate is comparable to such programs as the Denver STAR program, which noted a rate of 2.4% transport to hospital during their pilot period. Now, what we've reviewed thus far pertains primarily to the Portland Street Response first responder side of the program. Now we're going to be discussing the community health and peer support side of the program, which is really a true innovation that sets it apart from CAHOOTS and other alternative first responder programs. During the pilot year, PSR community health workers and peer support specialists worked with a total of 44 clients who were referred to them from the PSR first responders. Clients were quite diverse, around 40% or more identified as BIPOC. Community health workers and peer support specialists completed 437 visits with PSR clients during the first year of the program, with the average visit lasting 64 minutes. Client visits occurred in person, over the phone, and via email or text, and included a variety of activities, including helping clients complete applications for housing and benefits, providing needed supplies and resources, life skills training, including helping clients prepare for and transition into housing, social and emotional support, and going with clients to healthcare visits. Next, I'll show a graphic that really helps to show the overall impact of Portland Street Response, including resources provided to clients: 164 water bottles, 82 clothing items, 157 snacks or food boxes, 91 tents or sleeping bags, 144 referrals in the field, many of these to peer support specialists and community health workers working with Portland Street Response, who then made an additional 261 referrals to service. These included 92 housing applications and referrals, 29 shelter referrals, 35 financial and benefits referrals, 32 medical referrals, 15 mental health referrals, 16 client advocacy and culturally specific service referrals, 10 pet care referrals, and 32 other types of referrals, such as ID replacement, job-related referrals, and referrals for housing-related resources like furniture. And while the outcome of all referrals is not known due to when these data collection procedures began in the pilot year, as well as losing contact with some clients, and then also some providers not updating PSR about the outcome of the referral, we don't know the outcome of all of them. We know that most were successful. And most notably, 9 clients were able to obtain permanent housing as a result of their work with Portland Street Response, including some who had been homeless for 20 years or more. An additional 10 clients obtained 2 weeks or more of shelter, and 2 clients were able to avoid evictions and retain their housing due to their work with Portland Street Response. Now, in addition to the important work done by the first responders, the important aftercare work done by peer support specialists and community health workers, the team was also extremely successful in community engagement and outreach, which is so critical for a new program like Portland Street Response. They engaged over 2,500 community members in outreach and engagement activities in the first year, and provided over 1,000 supplies such as blankets, gloves, and hygiene kits to community members at 50 outreach and engagement activities. This critical outreach and engagement work included de-escalation trainings to OHSU clinical staff and other community members, door-to-door canvassing at businesses and residences to raise awareness about Portland Street Response, and participation in community events and festivals such as the Lens Community Cleanup on May 21st, 2021. PSR also helped lead the effort to keep unhoused and other community members safe during the record heat waves of summer 2021. setting up cooling stations in Lentz Park and bringing water, ice, and other resources to campers along the Springwater Trail. And in fall 2021, in partnership with the University of Portland nursing students and numerous community partners, Portland Street Response set up a weekly free mobile showers and health clinics at Lentz Park for any community members seeking care, but with an emphasis on unsheltered community members. In addition to showers and hot meals, people could receive wound care, medical advice, vaccinations, and referrals to OHP and other health services. These activities helped Portland Street Response develop a strong presence and trust with a wide range of community members, as will be discussed further later in the presentation. Now, I will now shift to a discussion of the feedback that we received from a variety of stakeholders throughout the pilot year. First, we collaborated with the Street Roots Ambassador Program to conduct 314 surveys of unhoused people. 159 in the first 6 months of the evaluation and 155 in the second 6 months in the expanded response area. We met people at their camps. We walked along trails. We went to parks, shelters, asked people if they'd be willing to speak with us about their knowledge of and experience with Portland Street Response. We provided them with supplies, information about the program, and a $10 Visa gift card. And this photo displays two ambassadors walking along a trail in Southeast Portland when we collected data in fall 2021. We began our surveys with unhoused community members by asking about general experience with first responders. This information helps us know how Portland Street Response can continue to develop and improve based on what is working well with other first responders, and also how they can make sure not to perpetuate unhelpful or harmful practices. Among those who reported incidents with first responders, 119 unhoused community members noted, so around 40% noted interactions with other first responders in the 3 months prior to our survey, with over half of those interactions being with police. Among those who reported interactions, 41% reported positive aspects of the experience, and 65 or 55% reported negative aspects, with the remaining 4% providing neutral responses. The majority of comments, positive comments, so over 50% of comments were attributed to EMTs and paramedics, while the vast majority of negative comments, around 77%, were attributed to police. But across all responder categories, individuals noted feeling that they were being judged negatively for being unhoused. One unhoused community member said, difficulty communicating with them because they just assumed it was drug related because I'm houseless. They're supposed to be saving a life, not judging a life, okay? Since Portland Street Response is dispatched through 911, it was also important to determine if unhoused people feel safe calling 911 if they or someone else needs help. Over half of those we spoke with reported not feeling safe calling 911, with reasons ranging from legal concerns to not trusting police to help them. One person said, I'll only call if someone is dying because I've never had a positive experience. I called one time for me and it got me arrested. Given evidence that communities of color have more negative interactions with first responders and lower levels of trust with 911, it was important to conduct additional analyses focused on the relationships between race and feeling safe calling 911 to access PSR. Similar to previous surveys done nationally, we found that rates of people feeling unsafe calling 911 were higher among BIPOC unhoused community members, with rates highest among Black people. Around 68.3% reported feeling unsafe calling 911. Next, we asked about knowledge of Portland Street Response. Across the entire evaluation year, around 30% of unhoused community members had heard of Portland Street Response, and 70.4% had not. Rates of not knowing about Portland Street Response were slightly higher among BIPOC unhoused community members that we surveyed. Encouragingly, though, there were some encouraging changes observed in the interviews that we conducted in the second 6 months of the pilot compared to the first 6 months. Specifically, knowledge and awareness of Portland Street Response among unhoused community members increased 7.7 percentage points from 25.8% at 6 months to 33.5% at 1 year. This was particularly prominent among BIPOC unhoused community members whose awareness of PSR nearly doubled from 19.3% at 6 months to 37.9% at 1 year. When we separate out Black unhoused community members we spoke to, their increased knowledge of Portland Street Response was striking, up from 15.8% at 6 months to 54.5% at 1 year, a whopping 38.7 percentage point increase. And while we cannot draw direct causal conclusions about the cause of these changes, given that different people were surveyed at each time point, it seems likely that the team's increased efforts around community outreach and engagement, particularly among BIPOC unhoused community members, is a strong contributing factor. We'll return to this point later in the presentation. "33 of 314 unhoused community members of 10.5% reported a specific interaction with Portland Street Response, ranging from meeting them during outreach activities to receiving services from them. When we asked their average satisfaction on a scale of 1 to 5, the average score was 4.64. So very satisfied. They said things like they treated us like humans, they were friendly and didn't come in with the attitude. They were nice, they talked to us for a while, gave us stuff and told us how to call them if we need help. One person noted feeling so thankful that their friend and campmate was able to be treated at their camp rather than experiencing the disruption of a hospital transport. When discussing the value of the program, numerous unhoused community members reinforced the importance of Portland Street Response being an alternative to a police response for incidents involving mental health crisis and homelessness. One person said it's a buffer between people and police, a way for people to feel safe about calling for help. Others talked about the value of the program for the broader community and talked about the team's kind, compassionate care. One person said it has great value. Someone with a mental health problem doesn't need handcuffs in jail. When someone goes to jail, it makes it much harder for them to get their life together. Another said, it's very positive for the community. If you don't care about society's most vulnerable, then you don't care about society. We also asked the Portland Street Response team to connect us with clients who would be willing to speak with us directly about their experience. We interviewed 9 of the 44 clients who described the kind, compassionate, client-centered approach of the team, an appreciation for how the team worked closely with them to reach their goals, and relief that Portland Street Response is now an option for them and the community. Indeed, their satisfaction is clear, rating the program a perfect 5 out of 5 on a scale of 1 to 5. One person said, you guys played a big role in a lot of challenges in the city. Like I said before, I can't express how important it is to have this program and to have each other, because it really counts. Not only as of what we are capable of, but who we are aside of the things that maybe haven't worked out for us. We are very much loved and we are gifts. They make you feel like you matter. Another said, I don't worry anymore. I can say I need Portland Street Response and I know it won't be the police showing up. One of the most important features of our evaluation are regular check-ins with Portland Street Response staff. We've been in close connection with PSR staff throughout the pilot in order to know how the program is working for them, lessons learned from their experience in the field, and additional resources or support they need to do their jobs effectively. In addition to attending weekly meetings with PSR and BOEC staff, we conducted quarterly focus groups or individual interviews with all PSR staff to learn about their experiences and to provide them with an opportunity to voice any concerns or make recommendations for additional support needed or programmatic changes. The team discussed a willingness to innovate, to take risks and lead with their vast professional experience in the field, and in some cases, their deep personal connection to the work, including one staff member who said, well, that's just one of the benefits of having a peer, is to start to build those relationships and just kind of being able to identify with them, how scary it is to be out there on the streets, and that there are places that can help them. The team did discuss wanting to have more flexibility to respond to calls inside residences and calls involving suicide. One team member said, one thing I think we need to be going on, and I know there's some barriers right now to being able to do this, is people who are suicidal. We're the better resource for a call like that. I mean, that's what I did at my last job all the time, is meet with people who were suicidal. So I just think it would be a very important next thing to add on. It makes no sense that we're not going on calls like that. The team noted feeling supported in their roles, but also some team members wanted more individual clinical supervision and opportunities for connection and training between teams. And this became particularly salient as the night team came on, and they felt there was some isolation and a gap in the knowledge that they were able to obtain from the original team. So it just really speaks to the importance of having close connection between teams for training. One person said, the only challenging part about it is there are opportunities as a brand new team to engage with the other team. People who hold the cultural knowledge and just general resources and how things are going is really low. We have an hour a week that we overlap with that. And then most of the time that is filled with other meetings that are important. But for the long term, I know that interaction between the teams needs to be different and a higher priority. Team members also expressed challenges related to sometimes feeling like a Band-Aid approach, given the lack of housing and services they can connect people to. They also noted concerns about differences in culture between Portland Street Response and the broader Fire Bureau that might make it difficult for them to retain their core unique identity. We'll return to discussing this when I talk about recommendations. Team members also noted challenges, understandably, of being such a highly visible, highly scrutinized program. Above all, though, the team demonstrates deep care for the people they serve and excitement to be able to help shape a program like Portland Street Response for the city. I'm really happy to be here. I'm really happy that Portland has this service. As a lifelong Portlander who has a lot of pride in my town, and as a person that has struggled with mental health issues, I'm really happy that we're available to folks. Now, moving to a discussion of other first responders, it was also really important to check in with Portland Police Bureau staff and Portland Fire and Rescue staff to find out about how the program was working for them. Their general attitudes about the program and to gauge how the program may ease their workload and provide an additional resources to assist in the field. Both PPB and PFNR staff suggested that expanded coverage and call types could help increase Portland Street Response's impact on their workload. Specifically, they wanted PSR to be able to respond to calls inside residences, calls involving suicide, and potentially calls involving a higher level of acuity, such as people in streets. PPB staff acknowledge that PSR is a useful resource, but they need it to be available more hours of the day and throughout the city. One police staff person said, I have heard good things about Portland Street Response. It seems like they are asked for more than they are available. So people want them to come. I had an opportunity yesterday, which I thought would have been perfect, but they were at another call that was going to take them a while. And I think people are starting to love PSR because we see the usefulness of them. And since they expanded their geographic area, that's appreciated. I think it's still just, well, I wish they were more available when we need them. For Portland Fire and Rescue, it seemed there were concerns that Portland Street Response was not being dispatched to certain calls that would be appropriate for them. One staff member said, I'm not necessarily noticing the impact to the station or to our call volume. And I don't know if that's maybe a dispatching thing. Last shift, the engine ran 22 calls. Of these 22 calls, one was critical. So there was a lot that could have been done by a lower level of care, except for the fact that's not how it's dispatched. It's dispatched at a higher level based on what the dispatchers are hearing, the complaints that are given. PFNR staff acknowledge the difficulty dispatchers face in parsing out calls, especially when you're talking about a medical complaint compared to a mental health complaint. They felt that PSR is not being dispatched to calls that would be appropriate for them because a mental health complaint like anxiety might be reported as something medical in nature, such as difficulty breathing. So speaks to the importance of having close communication between teams so that if firefighters do arrive to the scene and it appears that it's a mental health call instead of a medical concern, calling Portland Street Response in to take that call away from them. And then finally, or actually second to finally for the first responder side, staff from both agencies also expressed wanting more information about Portland Street Response call criteria and seeing a need for greater communication between teams. One PFNR staff member said, honestly, I think the most effective thing is actually a sit down face-to-face with crews. So PSR is starting their day, maybe call over to the station, see if they can drop in, say, hey, do you want us to come and tell you about the program and what we're doing and what calls we're taking? That'd be great. Similarly, PPB staff said maybe a call summary instead of a copy of a report, but a call summary. On this date, this time, this location, we responded, this was the calls, we were asked to solve this or to deal with this, and this is what we did. A lot of times the officers, they don't know what the end result is. We also talked about the developing relationships between responders and programs. While staff from PF&R expressed support for Portland Street Response throughout the pilot year, we observed noticeable shifts in attitude among Portland Police Bureau staff we spoke with, from skepticism or opposition for our 6 months evaluation to general support at 1 year. This likely comes from some positive experiences collaborating in the field and a recognition of the unique roles that both teams play. One PPB staff member said, "I think that the negativity around the start was totally based on politics, not on the actual PSR employees. I feel like just with any new relationship that has a bunch of baggage coming into it, once people actually have gotten to know each other and work with people, some of the preconceived notions have kind of gone to the wayside, because I definitely hear more requests for PSR." And then finally, we conducted 164 surveys with general community members, 80 in the first 6 months of the evaluation, 84 in the second 6 months. People were recruited by canvassing businesses and neighborhoods, asking if people had heard of Portland Street Response or interacted with the program. Similar to interviews with unhoused people, we began by discussing experiences with 911 and other responders. Almost half of those we spoke with reported not feeling safe calling 911 if they or someone else needs help, with many people discussing concerns about delayed service or non-response, and others being concerned about how calling 911 might negatively impact other community members. Rates of feeling unsafe calling 911 were higher among BIPOC community members, and similar to unhoused community members, rates were highest among Black people. 62% of Black people said they did not feel safe calling 911. For example, one woman said, "I've multiple times asked people in distress in my yard if they need help. I wish there was someone I could call to give them help, but I worry that something bad will happen. The person would be in danger more if I call 911 than if I don't. I also worry about how the police would react to me as a Black woman, even though this is my house." Next, we asked about knowledge of Portland Street Response, and across the entire evaluation year, 89 general community members we spoke with, so 54.3% had heard of Portland Street Response, and 45.7% had not. There were striking racial disparities in awareness of PSR, with only 38.2% of BIPOC community members having heard of PSR, compared to 68.2% of white people who had heard of the program. There were some encouraging changes we observed in the surveys conducted in the second 6 months of the pilot compared to the first 6 months. Similar to unhoused community members, a greater percentage of general community members surveyed reported knowledge and awareness of Portland Street Response at the 1 year point, so 60.7%, compared to the 6 month point, 47.5%. Also similar to the unhoused sample, awareness of PSR among general community members who were BIPOC nearly doubled, from 27.5% for the 6 month evaluation to 50% at the 1 year point. And again, I think a lot of this is credit to the outreach and engagement efforts that particularly focused on culturally specific providers and BIPOC community members. Now, about 26.2% of the community members we spoke with reported specific interactions with Portland Street Response, most typically calling 911 or the non-emergency number to request assistance and meeting the team when they responded in the field. These community members rated their satisfaction with PSR as 4.21 out of a possible 5 points. They spoke of the kind manner in which the team worked with people, including one person we spoke with who was skeptical about the ability of PSR to make an impact when we spoke to her in the first few months of the pilot, but who, after a very positive experience with Portland Street Response later in the pilot, changed her mind considerably, saying, "I had the opportunity to get involved with them when I had a person pass out on the sidewalk, and I called the non-emergency line, and they sent the street response team out, and I saw the interaction they had with that person, and it was really understanding and compassionate. The interaction was just amazing, because I know the city often has a bad rap of taking care of people who need help. And I was real impressed with the street response people." We ended the surveys by asking people who they would prefer to respond to calls involving people experiencing mental health crisis, substance use, distress, or homelessness. And respondents could select from the following options: police, firefighters, EMS, emergency medical services, Portland Street Response, or other. The most common answer was Portland Street Response, 57.9% of those surveyed. And what we found that when we separated out preference for first responder according to whether or not people had heard of Portland Street Response or interacted with Portland Street Response, We found the preference for PSR went up incrementally as people had heard of Portland Street Response, went up to 68.5%, and interacted with Portland Street Response went up to 79%. If individuals had reported a specific experience or interaction with Portland Street Response, we asked that they be willing to do a longer follow-up interview. And we conducted 30 interviews with community members who had interacted with PSR. And people discussed a variety of topics, including viewing the program as a necessary option for unhoused people and a valuable alternative to police for people in mental health crisis. One person said, "I don't think the police is the right response because they haven't broken any laws." And that was the kid's biggest fear. He was scared and thought he was going to jail. And so I think that us telling him they weren't and them showing up and not being cops helped reassure him of that. Otherwise, he might not have stayed for the help. Another said, "So I would say the consistency of Portland Street Response and showing up consistent is a huge asset to both our housed community, but more importantly, our unhoused neighbors, that they're learning to trust, and Portland Street Response is earning that trust, which is a rarity often in the type of work that we do." People also provided recommendations, including more preemptive outreach, the need for additional housing and mental health resources for the PSR team to refer or transport individuals to, a way to contact PSR more directly than 911. And they also encouraged the program to maintain a localized feel throughout the citywide expansion, which I'll return to next. So now the Portland Street Response has completed its first year, and informed by the data collected across the pilot period, I'll revisit, review, and revise the 9 recommendations we offered up in our 6-month report, commenting on progress made and work still to be done. Within these previous recommendations are new suggestions for programmatic improvement and expansion as PSR scales up citywide. We note that some of these recommendations are specific to the internal operations of the program, while others will require broader, more systems-level changes that will impact the success of the program over time. So first, the findings of our 1-year evaluation support the continued expansion of Portland Street Response to make its services available throughout the city and at all hours of the day. The recommendation is based on analysis of call data as well as feedback from each stakeholder group we interviewed. It's also imperative to expand call criteria to allow the team to respond inside residences, to be dispatched on calls involving suicide, and to respond to some calls involving higher levels of acuity. As Portland Street Response expands citywide, it's also really important to continue to cultivate strong community connections throughout the city. I think this is something that made the first year so successful, is they were able to really build that strong sense of community within Lentz and trust, to where the people they were responding to then saw them in outreach activities and developed that knowledge and awareness and that trust with Portland Street Response. It'll be really critical to, even with the citywide expansion, still be thinking of community centers, parks, other places where similar types of mobile hygiene stations, community fairs, et cetera, can be set up to make sure that community members really know, learn, and build that trust and that rapport with the team. Also really important throughout expansion to ensure that there's adequate staff coverage to allow for sufficient time with clients in the field. Something that we heard from PSR clients, from staff, from other responders, is they really like and value the fact that the Portland Street Response team can take more time with clients in the field and not have to rush from call to call to call to call. And I think with the current expansion and the limited staffing, they're finding that they're really quite overwhelmed with the number of calls they receive and not able to spend as much of that time in the field. It also could relate over time to more burnout and compassion fatigue. So it's really important that there's staffing coverage to allow the team to spend the time they need. And thus far, it seems that kind of a sweet spot we're finding is around like 8 to 10 calls. That's a good number to feel like you're really making an impact, getting a lot done, but you're not so overwhelmed that you're having to bounce from call to call to call and having calls wait for a long time and developing some of the same issues that community members complain about other responders. 2, trust the team to lead, but provide them with ample support. It's critical that the perspectives and experience of the PSR team continue to inform all programmatic decisions. They're well equipped to lead with their vast personal and professional experience in the field. However, given the high rates of burnout and compassion fatigue among first responders, it's critical the team receive ample opportunities for individual clinical supervision to process stress and secondary trauma. Based on our recommendations in the 6-month report, the team has now been connected to these clinical supervision opportunities, which is great. It's also important to provide opportunities for close connection and training among team members, especially as new staff come on board, and to develop preventative measures for mediation to address conflicts that will inevitably occur as the teams grow. Also very important to ensure open communication channels and transparency about programmatic decisions. 3, continue to refine community outreach and education efforts. Portland Street Response has made a considerable amount of progress in their community outreach and education efforts. In my team's interviews with PSR stakeholders, we observed modest gains in knowledge and awareness among unhoused community members, larger gains among general community members. PSR is currently working on a large social marketing campaign, working with culturally specific providers to ensure that materials are responsive to the needs of BIPOC community members and people with lived experiences of mental health challenges and homelessness. This is very promising. In addition, there's a need to focus education on that people can call to request help for themselves. It doesn't have to be someone else calling for the community members. People can call when they need help. An example of this is in a content analysis I conducted of 60 calls to 911 in which community members explicitly requested PSR. Only 5 of these 60, so around 8%, were someone requesting services for themselves. The vast majority are community members calling to request service for someone else rather than someone requesting service for themselves. 4, address 911 barriers and provide PSR-specific support to dispatchers. One of the most consistent themes across the community surveys and interviews we conducted.
Excuse me, Greg, I know you're on a roll and I'm sorry to interrupt, but I'm intrigued by the number of people who call 911 for themselves as compared to someone else calling for them for PSR. Is that different than the regular 911 process, right? Is that a different statistic? Right? How many people call 911 because they need help as compared to somebody else needing help? Do you know that?
I don't, unfortunately. That's a really, really good question. I think my assumption would be that ratio is greater. There are more people calling 911 in general to request help for themselves than we're seeing in the Portland Street Response call sample. We're only 8%, but I unfortunately don't know that information off the top of my head. If anyone else does, I'd be really interested, and I can make a note to check with BOAC about that. So one of the most consistent themes across the community surveys and interviews we conducted throughout the pilot year was that community members are experiencing a great deal of difficulty reaching 911 operators to request service. Concerns about calling 911 also pose a barrier. So it remains important to consider alternative methods for community members to access PSR, such as 311, 988, or a direct line to PSR at the 911 operating center, but also using this as an opportunity to promote systems level change, making people feel safe calling 911 because programs like PSR are present. By retaining Portland Street Response within the kind of dominant framework of 911 response, and increasing the types of programs like Portland Street Response over time, the hope is that then people become knowing and feeling safer calling 911, not thinking that 911 automatically equals police, but that rather that 911 equals police, fire, AMR, Portland Street Response. The hope is that could lead to systems level change over time, while also understanding and validating the understandable concerns people have about calling 911 to request PSR. And so continuing to brainstorm creative solutions and workarounds. 5, enhance understanding and communication between first responders. In follow-up interviews with PF&R staff, individuals requested more face-to-face meetings and report outs about the calls that PSR responds to. And in follow-up interviews with PPB staff, we observed noticeable attitude shifts from opposition or skepticism to general support for Portland Street Response by the end of the pilot year. The PSR team has taken important steps to increase understanding and communication between responders by creating information cards and attending some PPB and PF&R roll calls. And while this communication between responders is really important, PSR should continue to retain a focus on reducing presence of police and firefighters on behavioral health and non-emergency calls, and only use co-response when absolutely necessary. It's also really important for other responders to engage in the same kind of process of learning about Portland Street Response. Right now, it seems there's a lot of expectation that Portland Street Response learn about police culture and process, fire culture and process. And I want to make sure that also police and firefighters know and recognize the value that a program like Portland Street Response can have to them, and attend trainings with them, trauma-informed care, de-escalation, and really instill this idea that the culture of Portland Street Response has value to the entire response system. Related to this, we continue to believe that fire is a good home for Portland Street Response. It legitimizes it as a core part of the city's first response system and provides infrastructure that is directly connected to 911, but separate from police. However, the paramilitary and hierarchical nature of Portland Fire and Rescue may conflict with the Portland Street Response trauma-informed approach, harm reduction, and being flexible in the field to meet people with where they're at. Collaboration and communication is really important, but PSR must be supported in retaining its unique culture and identity and not be expected to fully align with the culture within the Fire Bureau. This is particularly important to consider when hiring new staff who may work across different Portland Fire and Rescue units, such as PSR and the CHAT program, the Community Health and Assess and Treat program. 7, address gaps that prevent PSR from connecting clients to resources. As we all know, gaps in the local system of care, especially permanent housing, subacute mental health care, and sobering centers, make it difficult for PSR staff to assist clients beyond their initial response. These gaps are also a point of vocal frustration among community members, some of whom unfairly equate the continued visible presence of a homelessness and mental health crisis as a failure of Portland Street Response. And this is something that we heard at greater rates in the second 6 months of the pilot, suggesting there were individuals who, again, unrealistically expected that Portland Street Response would be the answer to all problems related to homelessness and mental health crisis. And then as they continue to see visible homelessness and mental health crisis, they blame that on Portland Street Response and they get frustrated at the program. It's important to push back on that and remind them that Portland Street Response is one part of the system of care, but it's also important to know that as we fill in these gaps in the system of care, it will also increase people's recognition and understanding of the unique and important role that Portland Street Response plays. And some upcoming city and county programs may help fill these gaps, such as the Multnomah, Commissioner, yeah.
I'm sorry, Greg. I'm curious if you think the People for Portland campaign that was trying to make Portland Street Response be the remover of houseless people, if that played any role in the public's perception about what Portland Street Response is or isn't.
I mean, like I said, the timing of that did increase in the second 6 months, and so it's possible. We didn't hear, I don't recall anyone directly saying it was the Portland Street Response or Portland, or the People for Portland campaign that had caused that to happen. However, I think it is really important to constantly push back against the notion of Portland Street Response being an enforcement program. So we would always remind people they're not there to remove people. They're not there to force people into shelter. They're there to talk with people about what their options are. And if they so choose to engage in shelter or engage in services, they help to facilitate that process, but it should never be done as an enforcement model. We'll continue to keep our ears open for that. I recognize that'll continue to be a discussion that's had about what role Portland Street Response plays, and something that we will constantly need to be vigilant about, protecting the integrity of the model as a non-enforcement model. But again, in our interviews, I don't recall that coming up explicitly, but certainly could be a causal factor. We are encouraged by some upcoming city and county programs that are coming on board, such as the Behavioral Health Emergency Coordination Network Beacon that will help to fill in the gap of the Sobering Center. And then also make sure I get the name correct here, the Multnomah County Behavioral Health Resource Center, which will help to provide a day program, drop-in center for people experiencing mental health crisis and homelessness downtown, which will be certainly a godsend given all the need in that area. It's also very important to encourage continued collaboration with mutual aid and advocacy groups on the ground who've been a large source of support for Portland Street Response work through the pilot period, and continue to cultivate these relationships as the program grows. 8, continue to refine data procedures and outcome goals. Portland Street Response has been very responsive to our recommendations pertaining to refining data collection procedures, including the development of detailed charting manuals, data dictionaries, and interactive data dashboards. As the program expands citywide, it's also important to work with Portland Street Response partners and community stakeholders to refine outcome measures based on evolving project goals and lessons learned. We look forward to working with Portland Street Response and community stakeholders to say, this is what we learned in the first year. How does this impact our performance goals, our outcome goals, and really what should those be moving forward as we continue to develop a greater understanding of the role that Portland Street Response is playing in the first response network. And then finally, continue to advance racial equity. Based on our recommendations, the team has implemented more approaches for collecting data about clients in the field, specifically about race. It's important to continue to train around ways to sensitively ask clients about race within Portland Street Response's interaction with clients in distress. And encouragingly, we found high rates of awareness among BIPOC community members surveyed in the second half of the pilot, largely a result of the program's focused and concerted efforts on collaborating with and doing outreach to culturally specific providers. As the program expands, in addition to hiring people of color, it's important to focus on retaining people of color and also promoting or hiring people of color into positions of leadership within Portland Street Response and Portland Fire and Rescue. So this report marks the completion of the first year of Portland Street Response. There have been numerous challenges and hurdles over the course of the year, but the program has remained steadfast in its commitment to growing, learning, and responding to the needs of community, clients, and staff. There will be continued pressure on the program and a steep learning curve as it expands its staff, its client base, and its footprint on the city. As new programs grow and expand, there can be pressure to pivot to try to be all things to all people. What we heard resoundingly from community members is that they believe strongly in the core mission of Portland Street Response and see the program as one that is always authentically engaged in their effort to work with the community to bring about positive change. In the words of one community member we spoke with, what I've witnessed with PSR is it's not just about that first response and that call through 911. It's that they're proactively healing this community. Like before the call ever is made, they're out there knowing people, knowing their stories. Truly, they aren't coming out here with any kind of power. They're like, this is your community. How do we move your community forward? And it's just continued to happen. Indeed, Portland Street Response has come so far in a very short amount of time, from a small pilot program in one neighborhood to a citywide movement that has fundamentally changed Portland's first response system. Portland Street Response provides a model for the nation to follow, and we look forward to continuing to monitor its progress and impact as it expands citywide. And with that, I will say thank you, City Council and community, and I will take questions and look forward to rich discussion.
My colleagues are going to be shy. I see Commissioner Mapps is up. Go ahead, Commissioner Mapps. I'll wait.
Oh, thank you. I have a couple of quick questions, and I can, at some point, I'm sure some of my colleagues will want to jump in. So why don't I start, and then I'll pause and maybe jump back in. Greg, thank you so much for the presentation today. I'm really excited to see the good news that we're seeing out of Portland Street Response. I did have a couple of points I wanted to dive into and get some clarity on. First at like a very broad level, as I look at Portland Street Response and the evaluation that we heard today, I'm still trying to figure out the core mission of this program. Should I think of Portland Street Response as a initiative designed to stabilize people on the street, or should I think of Portland Street Response as an outreach program that's trying to connect people with special needs to services?
It's a great question, and I'll also invite Robin to chime in as well. I think that the core mission is the stabilization on the streets, meeting people where they're at in that first response. The value add of the ability to have follow-up care, peer support specialists, community health workers, is that there's that continuity of care that if you have a first response, it ends there. You can't go beyond that. With Portland Street Response, some of those calls end there, but they also have the opportunity to connect someone to services, both on the team, outside of the team. And what we always find with mental health services is that it's those gaps that occur where you lose people. So the fact that we have that ability to connect, the program has the ability to connect with people throughout that process means that there's more likelihood that that person actually gets connected to the services they need and that it doesn't end on the street. But I say that the core mission of Portland Street Response is that first response. And again, Robin, I'd love to see if you have thoughts to share and add.
Yeah, I want to also clarify that all of the aftercare support that is provided, it all starts with the 911 call. Mm-hmm. We're not going out and necessarily looking to build cases. These are calls that are coming into 911. we make a connection, we build rapport, and then we allow them the opportunity to continue to work with us. So I would completely agree with Greg. First and foremost, our mission is first response.
Great. And so I think we had close to 900 calls or whatnot, or 900, we had 903 calls in the past year. Of those calls, we had 44 clients that we appear to have worked with intensely. How did that special sort of subpopulation emerge? Did they sort of self-identify as people who were particularly eager for services? Was that a staff level driven decision?
So how it works is our responders go out, and if the person's willing to engage with us, we'll do sort of an assessment. And a lot of times people will share their stories. They'll start talking a little bit about, or you'll observe they don't have basic needs. So we start with, can we get you some clothes? We have some shoes in the back of our vehicle. And that begins the conversation. And so then we let them know, hey, we have community health workers and peer support specialists available if you would like to get connected to further resources. And we usually then give them a card, and then we also make the referral over to our community health workers who will try to relocate them at a certain time and place to do that follow-up. So.
Great. And here, this follow-up question goes back to Greg. I think in your presentation, you talked about 144 referrals. Were those referrals specific to that subpopulation of 44 people who were interested in getting more assistance, or is that part of the larger universe of 109 people that we initially went out and tried to find?
Yeah, so the one great question, the 144 referrals are part of the entire universe of 903 calls.
Wow. Okay.
And of those, the majority of them are the referrals that Robin is mentioning to the community health workers and peer support specialists. Community health workers and peer support specialists for the 44 that came from the 144. Among those 44, they made 261 additional referrals to housing, employment, et cetera. And then that's where you then saw that 9 of those 44 were then able to obtain housing. Does that make sense?
It does, although I'll tell you the truth. I think I took a slightly different message from the slides, but I'm glad we have clarity on this. Let me ask one more follow-up question, then I'll turn it over to my colleague, Dan Ryan, and then I may jump back in. It seemed like, based on the evaluation, we kind of have, let's say, imperfect data on the results of those referrals. And I also noticed that I think your recommendation number 8 would be to refine data procedures and outcome goals. So as we look at the next round of evaluations and whatnot, I don't know what the plans for your research design would be, but do you think there would be any way in the next iteration of this evaluation to have better information about how successful we've been to actually connecting people to housing services, mental health services, drug abuse treatment?
I do. And when you see me looking at the side, I'm taking notes so I can refer back.
Sure, no, totally.
Yes, so the process for tracking the outcomes of the referrals in more detail came on board after Andy Stevens, the data analyst, started working in October, and then that process was kind of clarified around November, December. So we really only have a few months of that more detailed process about the success or not success of those referrals. So fortunately, we'll have that in all of the calls moving forward. We'll be able to say with more precision about what the outcomes are. So yes, I think that's important. We'll continue to learn more. Right now, I agree, it's not as precise as we would hope, but moving forward, it will be.
Great, and I'm going to turn the floor over to Commissioner Ryan now. I may pop in with a couple more questions.
Great, thanks, Commissioner.
Hello, Dr. Townley. It's good to see you. Thanks for being here. And I want to start off by saying, first of all, Commissioner Hardesty, I have a lot of empathy for innovating and building. When you're doing that, you're going to get a lot of scrutiny. People have desire for change until they have to experience it or maybe change a little bit themselves to embrace it. So change management work is really hard. And I just want to tell you that's been most of my career. So I ask in the spirit of having empathy for that. So I hope that you heard that in from the sincerity that it comes from. So Robin, that's really looking at you and your team. So thank you. Thank you for building. It's not going to be perfect. Nothing's perfect. I mean, it's a first responder system. So people are in a place where they're not in a perfect place. And so we're trying to adapt and be innovative and offer better practices. And I see that evolving. And I want you to know that I do see that. So my questions are just from listening today, and then some things that I've experienced when I've been out in the field and wanted to, have this moment to ask a couple of questions. So so now I'll move to questions, just because I want to know more. Now I have to find my notes. It's kind of goes first of all, when I looked at the information about the fact that you're connecting with so many people who are homeless. And one of the things I've been pushing for is better relationship building on the ground with people who are homeless. Much improved data assessments in general on who's homeless. How many people are homeless? Who are they? What are the general needs that they have? So when we build services, we're mindful of that. And so when I ask this question, it's always about, as we're building a new system, how will that system overlap and impact with other systems we have? And I think it's really important that we say this is a shared responsibility with the county, especially when we talk about where we take people. The city is the first responder system. The county is the local agent government entity that has our services, if you will, from traditional jails to shelters to what we used to call sobering stations. We don't know what to call them anymore, but we know we need them. So anyway, I'm aware of that as somebody that's out there fighting to build something, and you get really aware of how we lack, not just in the county, but as a state. It's embarrassing how, when you look at the data of how many people are in late stage mental health and behavioral health, and then we lead the nation in not having services for those. It's completely embarrassing, and keep tuning in the gubernatorial race on that. So, but when I look at the integration, I think the part that puzzles me the most, because it's hard, is, and I think what you've heard from me is I never want to see this as pitting this first responder system against another one. They're all necessary. And I've never heard a police officer or fire a responder say that that's not the value, that they all have value, and how are we going to integrate that? And so my question is, what system are you setting up where there's actual dialogue amongst the people on the ground doing the first responder system? So that it's one thing when elected officials and bureau directors have this conversation, but it doesn't really mean anything. What matters is that the people on the ground doing this work are learning to see one another as one big team that is learning from one another and is improving the way that they respond as one big first responder team. So that's what I want to hear.
Robin might want to jump in and answer that, because that's happening from the very beginning. So Robin, you want to answer Commissioner Ryan's question?
Yeah.
And I was going to direct it to Robin, but yeah, thanks. Yeah.
I
was staring at her on my Zoom screen. I'm sure you could really see that. Yeah.
I could feel your eyes gazing at me. No, our first responder teams have been making direct contact with police officers attending their roll calls. In addition, we have regular monthly meetings set up with the behavioral health unit between our two teams that are on the ground. They actually meet monthly and talk about the overlap in the cases and similarities that they're seeing out in the field. And then part of Dr. Townley's recommendation has been getting more face time with even our firefighters, even though we're embedded within Fire Bureau. That doesn't mean that we always have that face-to-face interaction. So we've been putting more effort, and just this last month, we've been going out to stations and introducing ourselves. So there is definitely more effort between the people on the ground rather than just the management having these conversations.
And also, does that include our dispatching system, the first responder system that includes 911 and 311?
Our team meets weekly with the trainers over at BOIC, and then we one of our individuals, Britt, she's our licensed clinical social worker, has actually gone and shadowed for 4 hours over at BOIC and met with the dispatchers. And there's been an open invitation for any one of our crew members to be able to go and do that.
Okay, good. And then,
If I could just add to that with on the BOIC side, also based on the recommendations we made at 6 months that dispatchers needed more training, they've implemented a 30-minute training for all staff around PSR. And some of that includes the ability to connect with Robin and others who come and present about what Portland Street Response is and build that connection. And I know the team is also closely connected to dispatchers just out in the field through their radios. So yeah, and also with other service providers, they've developed both informal and formal relationships where they can call and consult and make sure that they're providing wraparound support to clients, that it's not just PSR, but PSR plus Central City Concern, Cascadia, Join, other providers.
Great. And then in terms of the navigation team, those are the outreach workers that are predominantly either housed at the county or directly with homeless organizations, homeless provider organizations. What's the communication like with that system? Because my point is, you're kind of a part of that now. You've kind of become a part of the navigation outreach system. So I have this desire to make sure that there's a way to plug that in and make it a part of a system. So
yeah, one of the things that we always do when we're meeting with someone for that aftercare follow-up support is we first ask, are you working with another case manager or case worker? Have you had interaction with other outreach groups? And then we try to connect and work with those other outreach groups as well. So our community health workers and our peer support specialists have really good relationships built with various community organizations that are offering that outreach support. And if you go to any of our events over at Lentz Park or Gateway Park right now, you'll see a number of those organizations working hand in hand. In fact, at Lentz Park, we've had 5 people who have been houseless, who've been living out in their vehicles, who've gotten housed because of those partnerships that we've had with other organizations that have worked with them through those pop-up events that we've hosted. So we have a really good working relationship with our community partners.
no, that makes sense. I'll try to wrap up and give my colleagues more space. Just a couple of comments. First of all, I want to acknowledge it's really clear that your outreach and engagement is really positive. And I want to thank you for that. I think it's a good culture change in general for all of us to lean into. And I think I'll go ahead and just wrap up there. But I think for me, it's always going to be following up how we can keep connecting the dots between the other systems and making sure that I feel like there was a premise that this was a retaliation against police. And I want to get rid of that. It's like, it's not helpful. It's how can this be part of building the best first responder system in the country? That includes a much needed gap that needed to be filled, which you hear from officers, you hear from fire. So that's the case. But I think we have to help the public get away from looking at it as competition, but it's about an integrated system. I'm not alluding to that. That's not what I heard today, but that's what you still hear when you're out in the community. And I think that it's really important that we go high here and then we build an integrated first responder system that just improves for everybody. And then I want to thank you in advance for working with the neighborhoods and the providers of the soon to be opening Safe Rest Villages, because I really do see Portland Street Response as being one of the preferred responders that will help us as we build those and maintain great relationships with the people who live in the villages and those who live around them. So thank you for that.
Thanks, Commissioner.
Welcome. Thank you.
Mayor, I saw your hand. I knew Commissioner Maps, I think your hand technically went up first, but
Go ahead, Commissioner.
No, I was creating space. I want to give other people a chance to talk.
Okay, back to you, Mayor.
Oh, no, please, after you.
I have questions.
I think we'll have plenty of time for all of our questions. Let me lower my hand just.
Okay. So Greg, I'm going to ask you 2 more questions.
I was going to go. Hey, what are you doing?
Oh, well, Commissioner Hardesty, would you like to go or?
Yeah, Commissioner Hardesty, why don't you go?
Actually, the mayor was next, and I'm after the mayor, and then you, Commissioner Maps, if you want to go again.
Perfect. All right. So here, I just have a couple of questions. First of all, I appreciate the report. Thanks everybody for being here and sharing the report. I just want to make sure I heard something correct, Professor Townley. Did you say over 50% of the calls were for mental health related issues? Did I hear that or interpret that correctly?
That's correct. Based on the team's observation of that individual or that individual's self-report, it was around 51%.
Great. And so I want to just underscore that as a really important point, because as should be obvious to everybody, the city's mission is greatly expanded in an effort to address the homeless crisis. And we are, in fact, taking a more direct and more active role in addressing mental health issues, as well as substance abuse issues on the streets before us. You said something which piqued my interest. It may have been Robin, actually. I take that back. I think it was Robin who mentioned that there's coordination with the behavioral health unit to discuss potential overlap, I think is what you said. Could you elaborate on that?
Sure. So we monthly, and we meet with all of their staff, their clinicians, police officers will come over to our headquarters and they'll meet with our staff on the ground. We'll talk about certain cases that might be overlap. There's times when we'll call BHU out from the field and do a consult with them, and they have the ability to do the same with us. I don't know the frequency to which there would necessarily be an overlap. I think that one really important distinguishing factor, well, two really with the BHU versus PSR, is that the behavioral health unit are dealing with individuals that are actually committing crimes, whereas Portland Street Response is dealing with individuals that are not necessarily committing a crime, right? That doesn't mean that one day one person could be committing a crime and another day they won't. So there's a potential that we would possibly be coming across the same individual just on so that's important for us to discuss and identify. And it's been also really valuable as we've expanded citywide and gone into downtown, just to kind of discuss the nature of those types of calls and responses that we're seeing that are slightly different than what we would have experienced in East Portland. So
what can you give us maybe an example or maybe describe for us what would the process be if it turns out that there is somebody that you're in contact with, the behavioral unit is also in contact with? How do you resolve that? Or is it just a matter of communicating and both delivering services? What happens in those situations, just generally speaking?
Yeah, I have actually not attended those meetings. They've been really with the folks on the ground, so I can't really speak directly to that. But what my assumption would be, being that I'm over the program in general, is that they're going to figure out who's going to take the lead on that case, right? Who's going to continue to work with them. Is our community health worker already working with them on case management? That's important to relay that back to the behavioral health unit team so that they know we're trying to get these connections and resources to this individual. If there's safety concerns, that would be another thing that would be shared as well.
Is there also any interaction or overlap with Project Respond?
Yeah, we actually have a really good relationship with Project Respond. We usually call them to consult, especially if there's somebody that we think might need an involuntary hold, in which case sometimes they'll come out in the field and assist us with that. I have a quarterly meeting set up with their management, and then there's a plan right now as well to introduce our teams to each other so that they can get to know each other as well, and maybe set up a similar process as to what we have with BHU.
I appreciate that. And Professor Townsley, for the next update, I honestly don't know when is that? Is that in another 6 months, or is that in a year, or do we know yet?
That's right. It'll be 6 months, so late fall, and there'll be another one 6 months from that.
Could you take a deeper dive in that evaluation on this issue? Because it's something that I'm very interested in, and just in terms of if we have multiple providers delivering similar services, how can we help this program in terms of streamlining the coordination or communication? Since you have nonprofits, you have the county, you have the city, you have the fire bureau, you have the police bureau. There's a lot of people who are touching this issue and working with some of the same clients. And I'd just like to know if there's more that we can do to be supportive of Robin or her team on that particular front. Robin, you mentioned something that was really interesting to me, and I'm hoping you can maybe elaborate on this. You mentioned the culture of the program is different than the culture of the Fire Bureau. And it was with intentionality that this program was located within the Fire Bureau. So I'm wondering if you could elaborate on what you mean by the difference in culture between your operation and the Fire Bureau generally.
Yeah, I think it's one is you've got a paramilitary structure that's been institutionalized for the last 150 years or so. You know, they have their traditions, they have their protocols in place, and then you have this brand new startup. And a startup is always going to have a different culture. And in addition to that, I think what also differentiates us from other first responder programs in general is that we staff our cases and we do biweekly clinical supervision where we're constantly going over our cases, thinking about how did we handle this with a trauma-informed lens? Could we have done something better? Sometimes we even practice meditation together in our clinical supervision. Just we really focus on self-care and we really focus on delivering excellent customer service. So that's our focus. Really, is the mission is making sure that customers are always centered. And in the traditional first responder system, well, not to say that they don't care about customer service, but they're not doing clinical supervision. They're probably not doing as much trauma-informed care training. We do it every other week. We're constantly analyzing our cases, thinking about how we can do it a little bit different and a little bit better. So also the other difference that we have is that we have multiple disciplines, whereas the traditional first responder system, you're an EMT and you've gone through fire-based training. So it's a little bit different in terms of you're bringing a lot of different experiences and points of view, and you've got a startup culture versus a very paramilitary institutionalized structure in place.
Robin, is there a recommendation forthcoming? Is there, or are you just stating this as a statement of fact and the environment in which you operate?
I think that this is a statement of fact. And honestly, you know, I don't think it's realistic to combine two cultures and not expect that there's going to be a little bit of like, you know, working that out. I mean, that's going to be true of anything, whether it's with fire or any other agency that we would become a part of. And so for us, it's just, I think, most important, and this kind of gets to Dr. Townley's recommendation, which is just face-to-face time. I think the more time our crews can actually get face-to-face and talk and get to know each other, the better things will start to ease together and we'll create that culture.
Good. And I respect and appreciate that, and I agree with you. Just wanted to quickly respond to Commissioner Ryan, then one more question to the good professor. In addition to the work that Robin has identified, as she describes it, face-to-face communication and reaching out, I'll also just remind everybody we have invested heavily in restructuring our overall public safety and community safety system under Director Myers. And so there's also a coordination at the top level to make sure that fire and police and BOIC and other emergency first responders are coordinating well internally at the city as well as externally with our partners. And I just don't want to lose sight of that big picture vision that we've all invested in heavily. Last but not least, Director, I think I promoted you, maybe I demoted you, I don't know. Good Professor Townley, thank you again for your report. It's hard to not see your great enthusiasm for this program, and I appreciate you highlighting what you see as the great strengths. Give me the devil's advocacy position. What should we be worried about as a city council overseeing a program that by all accounts seems to be running very well? It seems to be very well received in the community and by those who are being served by it. Are there any storm clouds on the horizon that this council should be aware of today rather than after the storm clouds arise? We always like to know in advance what we should be addressing.
I appreciate that. And I think most of these we raise in the recommendation section of the report, and they really are around the issue that you and Robin have just been discussing here about culture of fire, not expecting the Portland Street response kind of go lockstep into place in a traditional first responder culture, that there's actually much more that the city can benefit from Portland Street Response being able to retain a culture that is based on trauma-informed care and harm reduction, and that other responders can benefit from attending those trainings as well. And so I think that's where we're not saying take it out of fire, we're saying support it within fire to be Portland Street Response and not just a unit subsumed under Portland Fire and Rescue. It needs to retain that distinct identity. The program has so much trust from community, and I think that is something that can help to address some of these really serious concerns that we hear from community members about 911 and about their concerns about calling 911 and about concerns about what will happen if they do call 911. If they can be told and have trust that if they call and they request Portland Street Response, if the crime is not happening, and the Portland Street Response will be sent, that is the way that you instill good trust in the city for having a model that is intended to meet people where they're at and intended to address some of the understandable cultural mistrust in BIPOC communities and among people with lived experience of homelessness. And so that's where I think continuing to support and allow the program to retain that core mission, that it's separate from police. It's not an enforcement model. That's a storm cloud. I mean, Commissioner Hardesty referenced the People for Portland suggestions that it should be used to enforce people into shelter space. That is a storm cloud that I worry about, that I think that the city has a real responsibility to having a program that remains 100% non-enforcement, that we're meeting people where they're at, giving them options and helping them make those decisions, not making those decisions for them, which has been too often the hallmark of more traditional systems that are supposed to care for people but end up actually doing harm. I think that keeping the program well-resourced enough to, again, allow for adequate staff to have 8 to 10 calls a day. And when there are people say, why are they only going 8 to 10 calls? It's to remind them these calls require a lot more than simply going, not simply, all first response is hard work, but it's there to build rapport and relationship and talk with folks to find out what it is they need. They need time to do that. They also need time. I mean, there was at the Blanchet House, it took 3 hours to work with someone who had been very resistant to engaging with first responders. Portland Street Response was able to do it, but it took 3 hours. And if they're expected to go from call to call to call, that can't happen. And so adequate resources to allow for sufficient staffing, protecting the integrity of the model as non-enforcement, and allowing Portland Street Response to be the program that it was intended to be for the city. I think you have a real win on your hands here with this program. And I want to make sure that it retains that core mission that was informed by community from the start.
Thank you. I might jump in again at the end, but I appreciate your responses, Rob, and you too. Thank you.
Thank you, Mayor.
And let me start by really thanking you, Greg. You have been with us on this journey from the very beginning. And you've been on this journey in your professional role as an evaluator, as someone who follows the data and tracks the data. And I just really want to appreciate you and Portland State University's Houseless Collaborative for this partnership. We would not be here today if we had not started with that partnership early on. I also want to take a moment to really appreciate Robin, who has really left her heart on the floor so many times around this program. But it's been very intentional and specific about how we grow this program and make it available for the community. I really appreciate, Greg, you pointing out the cultures are radically different. Our fire and rescue is 93% men. They have a culture that's been built over 100+ years. And it is a very hard culture to change, just like the Portland police culture is a very hard culture to change. I want to respond to something I heard Commissioner Ryan say. Portland's street response was never envisioned as something that was anti-police. It was always envisioned as something that was a different first responder for people in crisis. The police were at the table from the very beginning. Every stakeholder was at the very beginning at the table. We left no one behind, including Portland Business Alliance and a whole host of other interests in this effort. So, and I understand that we're now over a year into the expansion, but I want to be clear. It was always intended as in addition to our first responder system. And I also want to say, Greg didn't get into this, here's the additional community benefit that Portland Street Response provides. For example, doing de-escalation training with business associations and neighborhood associations, creating opportunities for health fairs in community parks. So even though it is an expansion of our first responder system, it is not the traditional first responder, as I think Greg and Robin have said so well today. But the thing I wanted to, the question I have, Robin, is how do you protect the culture that you're building in Portland Street Response against the other cultures that, of course, you work with, but should not influence the culture of Portland Street Response?
Well, first, I want to say that there's a lot of good things that also come from being a part of Portland Fire and Rescue, and we have benefited greatly by the infrastructure that they've been able to provide us. So it's not to say that we want to reject everything that Portland has to offer to us. You know, I am so fortunate in that I have the ability to work closely with Chief Tim Matthews. He's the division chief over the Community Health Division. He and I very explicit conversations about protecting the PSR culture, and he's very much so in agreement that we need to protect this culture, and that there's something that can be learned from PSR and shared with others as well. And so one of the things that we're talking about, and I'm getting, this isn't just PSR, you know, that's self-initiating this. This is other departments and other programs that are also coming to us and saying, can we share training? Can we like actually do joint training together and really start building these relationships better? And I think that's going to be a really key part of it. You know, we have the clinical supervision that we offer. I've extended that as well to our community health assess and treat team, which is the CHAT program, also embedded within Portland Fire. And then you think about one of the key opportunities that we have by creating these EMT positions that we have for both Portland Street Response and the CHAT program is that they have an ability to work with us for a couple of years and then actually go and become firefighters. So you begin to create a culture from the very beginning with us that then infiltrates into Portland Fire and Rescue down the road later on. So there's multiple avenues to addressing and protecting culture. But I will continue to advocate with my leadership, with my division chief as well, anytime I see something that might be threatened to that.
I really appreciate the fact that you are going to roll calls, and I know we reached out to make sure that you did a briefing with Deputy Chief Fromm. And I will say that Portland Street Response goes wherever they're asked to go to actually provide additional information. I don't have any more questions. I just want to say how proud I am of the work that's been done up until this point. And I'm really excited about the potential as we move forward to institutionalize Portland Street Response. Let me also end by saying, I think the issue of people's fear around calling 911 is real. I hear that on a lot, and I'm hopeful that as we continue to do education around 911 and 311, that we're giving people the right tools, that they know what number to call when they need something. I'm looking forward to us coordinating a media campaign so that we are re-educating the public about when it's appropriate and when it is not appropriate to call 911. Because again, we have so many calls that go to 911 that shouldn't go there in the first place. And so again, thank you all for your great work, and we'll just keep plugging along and keep having the great success that we've been having. This would not have happened without community being at the table from the very beginning. And I'm very grateful for that. Thank you.
Thanks so much, Commissioner Hardesty. Appreciate your support.
And it looks like I'm the last one with my hand up. I have just two quick questions for Greg. Greg, the first question is going to invite you to expand on your recommendations concerning 911. And the second question is, I'm going to ask you to talk about if we were to fully expand Portland Street Response to meet the need in the community, how many teams does that imply? why don't we start with 911? I think your fourth recommendation included a set of suggestions for reforming 911 or doing better work over there. As the commissioner in charge of BOEC, I want to make sure that I really heard and absorbed what you said. Can you expand on that for me?
For sure. And this is certainly beyond my individual scope as program evaluator to make a decision about. It's way above my pay grade, so to speak. But I think that, as Commissioner Hardesty noted, the concerns around calling 911 are real. The reason right now that people are instructed to call 911 for Portland Street response, even though these are typically non-emergency calls they're placing, is because the non-emergency line is so backlogged that it's an hour to get through. So they're not getting through. And we heard that loud and clear in our 6-month evaluation. So call 911, you're going to get a quicker response. Then understandably, you have some community members who fear calling 911. And then you have some community members who say, no, I'm concerned about clogging up an emergency system by calling for a non-emergency response. Both of those are valid. So we need to understand and appreciate that those concerns are real and valid. What do we do with that? I guess ideally it would be figuring out capacity issues for the non-emergency number and making it such that calls can be accessed through the non-emergency number. I would say ideally it's transforming 911 overall. That's the transformative goal. Aspirational goal, have 911 be a place that everyone feels safe calling. In the absence of that, it's getting the non-emergency line within capacity to be able to take the calls quickly. It's having a direct line to BOEC that is still through the BOEC infrastructure, but that is not requiring people to dial 911. 311 is an option, but 311 is still going to come through 911. It's not a direct transfer. It's still using 911 infrastructure, is my understanding. No,
it doesn't come through 911 at all. No.
My understanding was that it still was someone at 311 that has to then send the call over to 911 to then dispatch a responder.
If there's an emergency, right? If they called an error to 311, then they'll send it. But it does not. Traditionally, their job is just to work through whatever the issue is and solve it.
Got it. But they wouldn't be able to dispatch PSR directly. And so that's where I think that I don't know that 311 is going to be a long-term solution for how we dispatch 911 PSR, given that it should stay within the 911 infrastructure. And so then that's where it's either using non-emergency, a designated line, or keeping it at 911 and work around trust and education to make people feel safe calling 911. Those are I see the three options.
Thank you. And I over the coming months, we should unpack that a little bit. Like you, it's my understanding that when we have 311 up and really rolling, they still won't be dispatching our Portland Street response. So there's some things to be worked out here, but I'm happy to partner with Portland Street response and the evaluators to figure out how to make this go. Now to my second question, which is, Greg, how many teams would we need if we were to expand Portland Street response, both citywide and to meet the need that we see out in the community? And I think that you've given us some data points that allow us to do a little bit of algebra to figure this out. I think there are different formulas that you can use. You've recommended, for example, that Portland Street response deal with about 8 to 10 calls per shift. And we should anticipate Portland Street response picking up about 4% of the police calls that are out there. With those two bits of information, I think I should be able to calculate how many street response teams I need if I were to just basically meet the community needs for Portland Street response. Do you know what that number is?
Yeah, and it's not a precise exact science, and it fluctuates. If we talk about time of day, if we talk about day of week, we talk about seasonality. And so that's why it's important to be staffed up at a level that's at the greatest need, not the least need, because then you have overwhelm and capacity issues. And it's also not an exact science because right now we're working with a landscape in which the Portland Street response call criteria are still narrow, right? So that 4% is with that narrow rate. With that, I think you could double that rate to 8% with expanded calls inside residences. Right now, there's 6 teams. The plan then would be in summer bringing on for a total of 11 teams, and then in fall, a total of 16 teams. At the current 4%, that 16 teams would be responding to about 5 calls per team per shift, which I think again, 5 calls is a lot to go on, but if we're then talking about expanded criteria, easily those teams will be then responding to 10 calls in that shift. And so 16 is the number that for both coverage for all hours of the day and citywide. And in order to keep it around that 8 to 10 sweet spot, 16 shifts is what is being recommended.
16 and that
16 teams. Yes.
Well, how many teams again?
Yeah, 16 teams. Correct. Working so 7 days a week, each team working 4 10s. So 4 days for 10-hour shifts, 8 teams at a time.
Okay.
It's 6 shifts altogether, 7. That'll get us 24/7.
Okay. So how many I think I just might have some audio problems. So was it 6 teams to provide coverage, basically 24/7, 7 days a week?
Yes.
How many people are a member? How many team member? How many people on a team?
So it ranges between 2 to 3 people on a team. One of the things that's come up recently since expanding downtown, so let me explain this. First of all, the team is made up of an EMT and a mental health crisis responder. That pair will always be going out.
Okay.
Then we have our peer support specialists that float on and off that team. That peer can sometimes float off so that they can provide that aftercare support if somebody needs additional follow-up. And so what we've learned since going downtown is that for safety reasons, the team needs 3 people on that team, 1 to kind of keep a lookout. We've had a lot of interference from general public members trying to interfere with our call responses. And so we need somebody to sort of manage the crowd while the 2 are doing the intervention.
Okay, thank you very much. That's helpful. I'll lower my hand now.
Thanks. And I mentioned to Commissioner Mapps too, but as part of the evaluation for the next year, there'll be a stronger focus on talking with BOEC dispatchers about their experience. That's been kind of a gap. I've been able to learn that secondhand, but I really want to be able to learn from them what they're seeing. And so I think that'll help also Commissioner Mapps to inform kind of next steps of what BOEC needs and what the program needs in that relationship.
And actually, one last question, just so I'm sure I understand. And so our current expansion plans call for us to get to 16 teams in the fall.
That's correct. So 16 teams, 58 full-time employees.
Got it. Thank you.
Mm-hmm.
Commissioner Ryan?
Yeah, thanks. You're now moderating this meeting. Thanks, Professor Tilley. The conversation, thanks, Commissioner Mapps, for bringing this up, but I think I want to get us on the public record because it's, when we talk about 311, it's not integrated currently into 911. In fact, it's under a different office. Is that under OMF right now? Okay. So we keep talking about integration as a theme today as we're building a new system. And so I think it's fair to say that we're looking at how to integrate that system better with the 911 system. Is that correct? My colleagues, maybe we could all agree to that.
I don't know that we want to integrate it. We just want to make sure that people are calling the right number for the right thing.
And I think, I guess I have an opinion on that it's putting a lot of pressure on the public to do that behavior change. So I think it merits a longer dialogue. And that's, I think, what I learned when I was listening to Commissioner Mapps and Commissioner Hardesty just then. You also, I consider you, Professor Townley, obviously a partner in the building of this system. Thanks for being here again today. And so you're contracted with Portland Street Response, and that's great. I saw some other partners listed there. Who are some other key partners? Like I noticed that Street Roots is mentioned with a big capacity number. Are they a subcontractor, if you will, as a part of the system?
Yeah, they're a really important partner. We would not be able to do that work of getting word out from people on the streets without their partnership. And so they do have a subcontract that provides funds for the Street Roots Ambassador Program Manager for her to oversee the work, and then for a range of 5 to 10 ambassadors to do hourly paid work for collecting surveys. Also includes funds for the $10 gift cards for unhoused people and people served by the program to talk with us, and then money for resources and bus passes for the ambassadors.
Okay, so will we put that under the category of outreach and engagement?
It's part of the evaluation contract, so it's research. So they're doing
research. Okay.
Yeah, it's research work. I think so. As an action-based researcher, I think research and outreach should go hand in hand. We do outreach by virtue of we give out the cards about Portland Street Response to people that they really appreciate. When we followed up with people, some of them still had the card pinned to their tent to know who to call. So we educate them about the program. That's outreach. But what Street Roots is being paid for specifically is to assist with research and data collection and evaluation.
Okay. And is there a learning community and the other homeless providers that are linked into the building as well?
Robin, do you have people in contract on the evaluation side? Street Roots is our only subcontract, but there might be others on the PSR side.
We do not currently. Mm-mm.
Okay, yeah, all right, this is good. We're building, so thanks. I just wanted to get some more clarity in my head right now. I'll put my hand down. Thanks.
I have a question, a slightly different question, but I want to go back to something that Robin said that sort of stunned me. So we have people interfering with the work that you're doing. Could you please elaborate on that? That's deeply concerning to me.
Yeah, we actually, this is happening weekly. And I've actually went recently to a PPB sergeants meeting and said this, and they laughed because it happens to them as well all the time. When we were working with, for instance, I'll give you an example. We were working with an individual that was outside. She was not wearing any clothes. She was clearly in distress. We were getting her some clothes. We got her some water and some food, and a passerby came and just took it out of her hands and started making threatening gestures towards her and towards our team. And we were able to sort of like create a wall to protect her. And the individual moved along, and we were able to give her more like water and whatnot. But stuff like that is happening to us. Or you have also people who are just wanting to help. And so you have individuals who want to try to help de-escalate the situation right beside you. And you're like, no, we're good. We got it. Thank you so much. So you have a little bit of both spectrums happening.
All right, that's and I'm sorry that's happening to your team, and I guess I'm not surprised, and I'm certainly aware of the interference that police officers endure, but I am surprised to hear that in the work that you are providing that people are interfering. I'm sorry to hear that, and if there's more that we can be doing to help on that front, let us know. My question really was aimed at something completely different, but thank you, Robin, for elaborating on that. Professor Townley, what percentage of the calls are repeat clients or people who, I'm trying to find a way to put this, but are just people that need a lot of service, and a lot of the calls come in for the same individuals? Is there some way to break that data down and say 20% of the calls we get are people who are responded to more than some number of times in some period? Is there some way for us to get more detailed information on that? Is there a group of individuals where if we provided them more concentrated services, we would significantly reduce the workload for PSR? Is there some way we can evaluate that? If not now, is that something we can do going forward?
Yeah, I think moving forward, that's come up multiple times. I think it's an important data point. The team does certainly respond to individuals more than once, and I think knowing the relative percentage of that is important. I believe that there is a data collection item on their charting system that they can push for like a repeat, someone that they've met before in the field. I think it could also be determined by virtue of, names and identifiers they're collecting. Robin, my sense is that's something that we can add to the evaluation moving forward that we've talked about, but not formed a specific plan for how to do that, but that we should.
Yeah, we absolutely can track that information. We do track that information. I couldn't tell you the percentage offhand. We actually, this is where maybe we're a little bit different than other first responders in that we kind of get excited when we start going on the same person repeatedly, because it actually gives us an opportunity to build rapport and trust. And we have lots of successes where maybe somebody wasn't willing to engage with us the first or second time that we met with them. But as we give them water and snacks and let them know that we're here for them and that we're a safe resource, they begin to build trust. And we've had people who have just turned around and connected with our community health workers as a result. So yes, we do track that. I think that'd be a great thing to add to the report moving forward, because it's a question that I have as myself. So
that would be helpful. And my suspicion is just based on my experience with other first responders, you're probably working with a lot of the same people on a fairly regular basis, which suggests to me that if there was some way we could identify people and provide them more significant, more intentional wraparound services rather than emergency response, we could potentially reduce the workload for the entire system. And so, Robin and Professor, that's an area I'm interested in for future evaluation, just in terms of data collection and response. Thank you for your response on that, Robin.
Thanks. And just a quick response to that, and also related back to your question about BHU and the connection there, which I agree with Robin, and a lot of it is based on these clients who they both have interacted with. I heard in one of the meetings that BHU officers had a hard time connecting someone who needed transport because they had bad experiences with AMR in the past. They were able to call in PSR, Portland Street Response, to do some of the lower level medical work on the ground in the field. And it helped to address some of that distrust that the individual had with a different arm of the first response. This is more of an anecdotal example of where I see the unique value add of Portland Street Response in multiple providers responding to that same person, but given the way that Portland Street Response approaches the work, instilled more trust in that one client to use PSR services when they weren't willing to use other services. So I guess it's a note that I think that there's a value add for everyone, but knowing that more specifically as part of the evaluation, as you're recommending, would be very helpful in figuring out who the best responder is and how many people are working with multiple responders.
So is there a chance we could start collecting that data for the next evaluation report?
Yep.
All right, thanks.
Thanks. Commissioner Mapps?
Yeah, I know we're short on time, so I'll try to make this quick. I think this question is for Robin. The mayor's previous question raised this for me, and that's the sort of, can we get an assessment of the amount of level of danger that our teams face when they go out in the community? I'm thinking about this a lot, especially as we think about expanding to different types of calls. How often do we need to, do we find our teams at risk? How often do we need to call cops or some other service to provide mutual aid?
Dr. Townley, do you have the statistics on last year, the number of times that we marked an incident had escalated and we requested police assistance?
Only 10 were marked as escalated, and most of those were verbal escalations. There were some police assistance that were for someone needing to be hospitalized, but it wasn't because of a risk of danger to staff. It was a risk of danger to a client. Only 10 calls were specifically marked as ones that escalated where the staff felt that they needed backup for themselves.
Okay, thank you.
So my last question will be, we've been talking about expanding call types. When will we continue? When will we know? When will we start moving the dial so that Portland Street Response has more call types that they will respond to?
We've met twice now with the committee that the city agreed to form with the PPA, which is the Portland Police Association. And so we've met twice. We have a bi-weekly meeting scheduled. I have a meeting that I'm going to be scheduling here as sort of a subcommittee broken off. So my goal is to I have every intention of meeting that June 30th deadline. Now, there will have to be policy changes probably from police's end and protocols and whatnot, and that will take a process. So I'm not sure what that timeline looks like, but council will have those recommended expansion and criteria by June 30th.
Excellent. Thank you very much. And again, just thank you so much, Greg Townley and Robin Burke and your team. I'm very proud of the work we've done so far, and we are building it as we are using it. So thank you again.
Great work session, everybody. Thank you all very much for being here and sharing with us. Good conversation, colleagues. We are adjourned.
Thank you.
Recording stopped.